instrument called the mini mental state, constructed by Marshall Falstein from Johns Hopkins. Now, Marshall Falstein, if you read the paper, tell you that the instrument, the mini mental state, is actually meant for Anglo-Saxon population, the English population, people who are educated. If you are not educated, there'll be a bias. Then you diagnose everybody as dementia, because it requires people to be educated to understand the question. And also, if you were to use that kind of instrument, it takes about half an hour to administer the questionnaire. Right? Half an hour. All right, so we discussed it at World Health, and I told them it's impossible to use it in Singapore or even Malaysia, because I'm sure the GPs here will tell you only have about 15 minutes, per patient. You don't have the luxury of time as you have in America, or in England. When I was working in England, in Oxford, I only saw 2 patients in the morning. You see 3 a big day. Same thing. When I was working at Harvard in Massachusetts General Hospital, also 2 patients to them. But that's wonderful work. You see the patient examine, then you tell the relatives, and you feel very happy about it. But in Singapore, it's about 20 patients. And in some clinics in Singapore, 40 patients. You have no time. So you got to think of an instrument that can be relevant, that people can use quickly, and give you a good screening. And from the World Health research, we got about 200 old questionnaires. We pared down or dwindled down to about 10 questions. We are predictive of dementia. Next one, please. So I just showed to people that the clinics in Singapore, or even the polyclinics and the outpatient, is a bit like the marketplace. This is the marketplace. Anyone recognize this place? This is in Kota Baru. A couple of years ago, I was up in Kota Baru. Maybe you can dim the lights first. You can see the pictures better. In Kota Baru, the marketplace is so colorful. The women there wear all the beautiful dresses and all that. But I wonder where all the men. So they ask me what the men. So I tell people it's something like that. It's so crowded, and people come in for 15 minutes, 10 minutes. In fact, the GPs in Singapore told me that, wow, 10 minutes is luxury. Sometimes you see 5 minutes per patient. So within that 5 minutes, you have to do a quick screening and help the doctors. So we came out with an instrument called the Elderly Cognitive Assessment Questionnaire. And it's a questionnaire that determines your memory, a quick test with a number, and then ask them in 5 minutes time, and how the age, their birthday, and carry on. I think you have it in your that handout you have, from the neuroscience society. It's about 10 questionnaires, but the whole research took us 2 years, because after trying out, you got to send to the World Journal for publication, and whether the scientists agree with it, you try it out, and they might disagree with you, and after 2 years, you came out in American Journal, and this is used now. I think that apparently the psychogeriatrician in UKM, Rose, spoke to the minister, and in Malaysia, during the pilgrimage to Mecca, they realized that many elderly people go to Mecca, and in a hot desert, they become dehydrated, become delirious. Then they come back home, they realize this person actually having early dementia, acute on chronic, So they want everybody who are 60 years and above, isn't it? Before they go to Mecca, they must be assessed by a doctor, a GP with this questionnaire. If you score less than 4 points, then there's something sinister. Need to go for a second phase, more thorough assessment for dementia. And so this is a very good way to help all of you. Like someone told me that you should take a patent, and then everyone who uses it, charge them $1 and then I can retire now, like Dr. Taibaran. Move on, please. Okay, so some of you who are doing research, and somebody from the back, the research, you got to make sure that the validity coefficient is down there, is very high, and also it's reliable, the pi coefficient is high. These are published in all the Europeans and the British and American journals. I'll mention something now about Alzheimer's disease. The dementia is a very broad umbrella, a very generic term, and the commonest form of dementia is Alzheimer's disease, and the second commonest is vascular dementia, the dementia linked to stroke, multi-infarct, and the third are others, which sometimes you pick up in our investigation, people with B12 deficiency, folates, even now Parkinson's disease, all right, or people with hypothyroidism, but commonly it is Alzheimer's disease or vascular dementia. Sorry. A very famous psychiatrist in Germany, in Munich, named Emil Kraepelin. Now, some of you in the IMU exams will know that Philip put a picture of Emil Kraepelin and asked the students, who is this man? Which I thought was a bit unfair. Emil Kraepelin was a very famous psychiatrist from Germany. He was famous because, like many of you, he was a clinician. And from his clinical experience, he knew that there's a difference with the patients you see in his clinics, that there's a group of patients who are diagnosed as schizophrenia, another group called bipolar or manic depression. And he able to dichotomize these two categories of people. But Emil Kraepelin had a young researcher, RA, assistant, his name was Dr. Alzheimer's, a young man, and he told him that there's a patient in the ward who had poor memory and died. So at one time they diagnosed, they called schizophrenia dementia precox, precocious dementia. You thought that, well, schizophrenia is like dementia, memory goes off. But this lady was a bit young, 54-year-old lady. So he asked his assistant to do a post-mortem and find out what's happening in the brain of this person, because a few years before that, there's an invention of a new instrument called the light microscope, and so this young lad took the brain and then did slices, and under the microscope he saw something that we'll talk about later on, amyloid plaques and tangles. So because it was so well presented, at the end of the meeting in Munich, Emil Kraepelin said, since you've done so well, described so in great detail, we shall name this disease after you, Alzheimer's disease. So now after 100 years, many people in the world, even in this room, don't know who is Emil Kraepelin. Don't know who is Emil Kraepelin, but they know who is Alzheimer's. So I'll tell Xavier, who is now understudying Philip. Although you are a junior doctor down there, don't worry. You study hard, you work, you do research well, you'll be more famous than Philip. All right. So and move on a little bit on the symptomatology. Although the research will tell you that, well, it's early memory that's gone off, short-term memory. The patients will tell you, I've forgotten what I had for lunch, but they'll tell you in great detail what happened in the Second World War. So this is typical. But now we realize that even before that, before this phase comes in, there's some changes in what they call executive function. Things they can do, they suddenly cannot do. I'll give a perfect example. The foreign minister of Singapore was one, Mr. Rajaratnam. He has linked to Seremban because he was born in Seremban. And he about 10 years or 15 years ago, his nephew rang me. His nephew is a neurosurgeon. Hey, there's something wrong with my uncle. He suddenly he rang his nephew and said, hey nephew, I've forgotten how to reverse my car. I can't reverse the car into my garage. So the nephew, right, sports car, the young fellow, came, and he said, yes, what happened? Then he rang me and said, hey, there's something wrong with my uncle, and he's this fellow. so I admit it. So because we know he also knows about medicine, very good medicine and psychiatry, there's a possibility of early Alzheimer's disease. Do you know the family here? The family is still here, isn't it? Because his brother is a GP who met us in Johor Bahru. He told us, his brother, this minister, that I'm only GP in Seremban who drives a Rolls Royce. Right? So you must ask people like Xavier to buy a Rolls Royce. He'll say, I'm the only psychiatrist in Malaysia to run a Rolls Royce. So executive function, although he could remember things, but he couldn't do the things he's familiar with. Similarly, I was working in Harvard in the clinic as a lady who was brought to see me, and this lady owns a hotel in